Welcome back to another episode of the Nursing Now podcast. I'm your host, Janelle McSwiggan, and I have Chelsea Strawn on here. She's a nurse and a certified case manager. So, this episode is talking about case management. Chelsea, thank you so much for joining me today.
Thank you for having me.
Absolutely. So, can you tell my listeners a little bit about who you are and what exactly you do?
Sure. So I'm, like you said, I'm a certified case manager. I'm currently serving as the AVP for case management at Allegiant Managed Care, which we'll talk about later about what that means, right? Like managed care and workers' comp, all the things. But by trade, I'm a nurse. I am a registered nurse. I'm also a certified case manager. And yeah, so I'm also, have a little other venture where I serve as a consultant in the workers' comp space.
Awesome. And are there different subspecialties within case management? I heard you say workman's comp. Is that a particular niche that you can get into?
Yeah, so case management essentially, if we're working at the bedside, we are in communication with our case managers, right? Like they're setting up our discharge planning and so on and so forth. But once you dive into the workers' comp space, many people, are not familiar with that. It's kind of that little hidden, market. It is very specific to, obviously anyone that's injured at work. So it can be someone on a boat, right? Like a barge worker. It can be someone injured in a factory to your nurses and doctors injured while they're, serving their patients. So we essentially coordinate their care and help them return to work as safely as possible.
Such a good point there. There are a lot of people injured
Yeah.
on the job. So what exactly does case management look like for the workman's comp space? Like what is your day-to-day and what are some of the rules so our nurses can kind of really understand what this word means?
Sure. So it can look differently. There are, even within that space, it can be a little bit different. So we have your field nurses who all of their work, right, like their day to day work at the end of the day is at home. So it's a hybrid schedule. So they're going out with the injured workers to their appointments. They don't ride with them, they travel in their own, car to meet them at their provider's office. And they're getting an update, and then they're sending that information back to the carrier there, which is the insurance company. And so if that doctor orders an MRI or a surgery, what have you, then we are coordinating that as, as it's approved. Sorry,
That's okay. That's
as it's
okay.
approved by the insurance carrier. We are sending monthly reports, so that when that claims adjuster or that insurance company looks, they need to go in and look, oh, what happened this month on this particular claimant, they can have that, information in front of them. We're also communicating with attorneys to give them updates. If that, injured workers are presented, we want to make sure that everyone is, in the loop. So we're essentially a unbiased party to help coordinate care and again, help that injured worker return to work um, as safely as possible. Um, so when I say it's a hybrid schedule, that's a field case manager. We also have telephonic case managers who work completely remote. That is an option. We also have quality assurance staff. So maybe you've worked as a field case manager for a while. You may move into um, a management position, or you may move into like a quality position. So there are different avenues. I mean, I've even had a nurse recently that moved into a sales position. So there are all different avenues within workers' comp for nurses. It's very, open. The opportunities are open and endless. And I always say, if you love it, and you'll never do anything else. It's kind of it's a big family. It's a very small community. People don't realize that, but it's a great industry to work in. I personally love it and will never do anything differently.
That's so exciting. I had no idea the different roles a nurse could have within case management from field to telephonic. Yeah, that is so cool to hear. You mentioned that if you love it, you love it. Do you notice certain personalities being more drawn to this role than others, or is it just totally random?
Yeah, I do. I do notice that, if you are someone who is an adrenaline junkie, you really enjoy that ER work, we're not that. We are not, isn't we're not like, we do get catastrophic files, but we're not doing hands-on care. That's really important. If you've worked in a home health role or you've been in some sort of capacity that's put you out on the road, it's similar in that way that we have to be, independent. Number one, no one's working there watching you work, making sure you're getting things done. So independent. And also, you don't have that collaboration with your team every day. So you're not working in an office with other people every day. You do see your injured worker, but that's really it. So your teammates, while you do have a team, you don't ever really see them. You might see them once a quarter or maybe a few times a year. So you need to be able to really work independently and be okay with not, with leaving the patient care part behind. Yeah.
It sounds like you might still have a nice bond with some of the patients, though, that you're working on with this case. If you're going to doctor's appointments and maybe you're on it for a longer point. So leaving patient care behind, but maybe not leaving the connection of being with the patient. Do I have that assumption right?
So it's really important that we are. So there's two things, and I wanted to say this earlier is that
Mhm.
we are expected, and it's important that we stay up to date on all the current medical trends, right? So if there's some new, just for instance, one of the doctors here in Tennessee, he's just started doing ultrasound guided carpal tunnel releases. That's new and it's very innovative, and that can be a huge savings for the insurance carriers if that sort of thing is approved. So we want to stay up to date on that. We want to know, is that appropriate? Is that something we would suggest as a nurse, even though we're not in the midst of it, we're not at the bedside, we want to stay up to date on the current trends. But then also, like you say, even though we're not providing that hands-on care, it's important that we, maintain empathy, maintain compassion, but then also stay professional because we are working. Our referrals come from the insurance company, from the employer, and from, so essentially, yes, from those parties. So we have to be an unbiased party, right? So we
Mhm.
always want to act with kindness. We always want to act with empathy, but then also just, you know, like I say, maintain a caring and compassionate stance toward anyone that we come into contact with. Even if it's someone such as the physician's office of anyone that we come into contact with. Yeah.
This is a fascinating little niche of nursing. I knew none of this before, so I'm actually
Yeah.
really
Yeah.
excited that you're here.
So
So can you tell me a little bit about your journey as a bedside nurse to a case management nurse? Did your bedside specialty help you with the transition at all?
yes, so I actually started at the bedside on a cardiovascular step down unit, transitioned into home health, and this is a whole other story. We won't get into. We don't have time for it today, but basically had a really traumatic. I had a wreck and was essentially a work comp patient. Didn't work for a year. Ended up working in a physician's office, a large physician practice that saw mostly work comp and was kind of drafted into work comp or case management from there. And then after about a year and a half, I stepped into a management role, and the rest is kind of history, right? But I like to say I've seen the work comp process from all sides, from being an injured worker who essentially couldn't work anymore in their role to not working for a year to being a case manager and then being a manager. So when a work comp patient would say, you don't know what it's like to, have this catastrophic injury, or you don't know what it's like to maybe not be able to provide for my family, I could say, I do know what it's like, and this is how we're going to navigate this process. And, there is hope maybe on the other side of this. You can't guarantee outcomes, but you can say, I've been where you are. I do understand this process, and even helping the employer maybe understand how to walk through that, or the physician to understand. And then, even seeing it from the physician's nurse standpoint. And like we talked about my venture, that's why I went back to helping the physicians. They just want to take care of their patients, and just really going back to a full circle side of things now.
Yeah, it sounds like you have a really unique experience coming from being the patient and now supporting the patient. And I could definitely see that nurse quality in you really shining. I love talking to nurse entrepreneurs because I think they just bring out the best parts of being a nurse and just so wonderfully empathetic. And then, well, not an entrepreneur, but in a non-traditional role. And they put that spin on a new industry that I think just really brings a lot of beauty to a new industry. And I can tell by the way you spoke right there that that's kind of what you're doing too.
Yeah.
Um, so I'm gonna have to edit this part out. Sorry.
No, you're good.
So, how did you get started in case management? I've heard that there is a very large barrier to entry and that certification is pretty high up there. So, can you share for our nurse listeners how you got started?
Sure. So, like I said, I was working in the physician's office and I was constantly in contact with other case managers. So I had a couple of case managers at the time. My son was just born with a brachial plexus injury, and we were constantly back and forth to Shriners Hospital in Philadelphia. They knew that. They knew that this was a time that I needed a change, and they said, "Hey, have you ever thought about case management?" And I said, "No, that's not even real nursing. I will never do that." And then through a lot of prayer, a lot of discussion, I said, "You know what? I'm going to think about this," and I did. The day of my son's first surgery at Vanderbilt Hospital, I drove home. My husband stayed with him. I interviewed, and it's just been a perfect fit. It's been a natural fit. Yeah.
I love to hear that you're shining in a different role. I also love when someone else suggests the role to someone. That's happened a couple of times on here. So it just shows the power of not only like networking, because I feel like networking is such a stiff term, but I guess like authentic connection and just showing someone else like your true self and your personalities and, your ups and downs, and then someone else like offering an opportunity to you that like suits your point in time.
So when I became a manager, I didn't forget that, right? So I did step into a manager role where there were several seasoned case managers, but we also had a lot of turnover. We were at a position in our company where there was opportunity to hire new case managers, and I said, I want to hire case managers who need the same opportunity. And I can tell you of several. I can tell you one nurse who had only been a nurse for a year. That's not typical. They want you to have 4 years plus experience. She's one of the most stellar nurses, case managers rather, that, I mean, she's wonderful. I can tell you of another who had no work comp experience. Again, one of the best. I can tell you of another that was working 3 jobs, 3 nursing jobs, and to make the pay that she needed to live in Nashville. We all know Nashville's very expensive. And I said, let's do this. Let's do this case management thing. And she was so tearful because it was life changing. So I think that's, for me being a manager, that's what it was really all about, was offering that opportunity to someone else to change their life. Right. I even had a friend who, she was very hesitant to step into case management, and now she's a wonderful leader at the company I was at before. So, you just have to open up those doors for people. If I could say anything to the other companies out there, it's take risk on people without experience. There's loyalty there. They don't have to have the certification will come. It can't come until they've sat in that role for a year, right? So let's go ahead and open the door to the new people. Yeah, I think let's do that, especially in especially in workers' comp. Yeah.
Yeah, one of my biggest mottos is we all have to start somewhere. Like someone has to give someone a
Yeah.
chance.
Yeah.
I know someone gave me a chance with writing and I'm killing it. So as a manager, what do you look for people that might be a good role for case management that haven't ever done it before? Are there certain personality traits or maybe bedside experience? What are you looking for?
I mean, so the nursing school answer is they want you to have three, 3 to 4 years experience, and they want you to have a diverse, background. They want you to have either ICU or ER, whatever. And then some maybe sprinkle in some home health because they want to know that you have the capability to work independently and on the road. That's not going to scare you off. Those sorts of things. Now the Chelsea answer, right? I'm looking for work ethic. You can't teach work ethic, right? I want to know that you've had a little bit of experience. I want to know that you can our technology is evolving, and even in workers' comp, we're seeing AI implemented in some areas. So I want to know that you can, flow with that. But I also want to know that you have work ethic, because we're not an 8 to 5. You may have an appointment that starts at 8 o'clock, an hour from you, and then another one at maybe 1 and 3, and then you've got to come home and do paperwork. On the flip side of that is you may have 2 days without appointments and you're at home with your kids. So I'm looking for work ethic. I'm looking for teamwork is the most important thing. We have to cover for each other often. And so those are probably the two most, and responsiveness. If I send an email or follow up with you, I'm looking, are you showing up for that interview 15 minutes early, and are you responding same day? That's huge, because how you respond to me is how you're going to respond to our customers.
So
Yep.
true. Thank you for sharing those aspects of what you're looking for, and also that insight of the job that you might have a longer day one day and then a brief pause the next 2 days. So it does seem to kind of even out, but I could see someone that loves routine and wants to get out at a certain time and really thrives on that, like 9 to 5, not loving that break in routine. So I do understand that there's a important distinction there.
Yeah.
So interesting about the ICU and ER experience. Is that just to show that you've had a little bit of everything come your way at the bedside?
Yeah, it doesn't have to be those areas. I mean, it could be, med surge, what have you. It's just that the nature, and orthopedics that's a great background. That I would say 80% of our claims are injured workers that we get are going to be orthopedic, neuro, something like that nature. That doesn't mean we don't get others. That's just the majority. Because if someone gets hurt at work, it's usually, a back claim or knee,
Mhm.
ankle, something orthopedic related.
Interesting, interesting. Good point. Yeah, thank you for telling me how that ties in. So, do you have any particular advice for people that are trying to overcome that barrier for entry? You mentioned that you can't get the certificate without having, I think it's a year of experience, right? But I've seen so many jobs listed for case management where they do want you to have that certificate. So it's kind of like a catch 22. So do you have any advice for anyone trying to overcome that? Do
Yeah. So
Go ahead.
yeah, well, if you're looking for workers' comp specifically, I mean, you can always start so your companies like your other managed care companies, your Humana's, your Blue Crosses, things like that, they may not require the CCM. They have a bit much larger volume. So you could possibly start there and not have your CCM yet, but then once you've sat under someone for a while, apply, get it, and then move into workers' comp. The other, the flip side of that is, I started a company, Lighthouse Career Services. I'm always aware of openings for case managers, and even some that may not require a CCM. So if it's the right person, I always believe in networking. Yes, and sometimes if it's the right, like I said, if it's the right person, they're willing to take a chance on the right, and wait on that CCM. And probably the reason why they're seeing that is some states you can't practice without a CCM. So it just depends on the state they're in. We're jurisdictionally governed. So it's, it depends on their state. What state they're in makes a huge difference in what they're allowed to, you know, what certifications are needed, so on and so forth. And so, I know you're going to post, how to reach out to me. They're certainly able to contact me with any questions. But yeah, I would certainly suggest that, look at your state rules and so on and so forth. Yeah.
I feel like this conversation is just like an onion that I'm peeling back more information. Like I didn't know that you guys are state governed too. That's so interesting. Okay, so this really is like a super individualized conversation
Yeah.
for everyone state by state.
Yeah. Yeah.
Super interesting. I like that you brought up networking. I didn't really understand the point of networking. I definitely was someone that relied on their degree and their intelligence and just thinking that that would really carry me. And man, was I surprised to learn that it did not. I'm naturally a wallflower. I don't really talk a lot at parties or anything like that. So I really had to break out of that. And networking has done more for me than my master's degree has for opening doors. I'm definitely very grateful for my master's degree, but I just really thought that having a degree would really be the carrying factor. And it really is networking. So I really can't stress that enough. So I'm not surprised that you said networking.
Yeah, yeah, definitely networking, and some of that, our industry is so tight knit. It is kind of, trying to break in that way. Mhm.
Mm. So you do have a master's. Do you think your master's degree helps you in getting jobs in this industry? Is like a master's degree, sorry, I think I have to rephrase that. um, so you have your master's degree. Do you think that a master's degree is held more favorable when you're looking at job applications for these roles?
No, I don't think a master's degree is necessary. If you're wanting to start out in the field of case management role, most of them are going to say that they want you to have a BSN, but I don't even think that's, quite necessary. I think it's preferred, but I think if you have an associate's with the right amount of experience, or even if you have an associate's with a CCM, like you've worked at one of these larger companies, I think that's going to be, appropriate. Or even if you've worked for an employer as a occupational health nurse, things like that. I think that's going to be more favorable than having a master's degree. Now, if you were to work for, a company and you decided, oh, I want to get my master's degree because I want to, move up in management or so on and so forth. Once you get into workers' comp, it is highly it's highly moved by um, networking. So I don't know that even then that a master's degree would be necessary, totally necessary. I did it just because it was something I wanted to do. I still, have things I want to do, but I don't feel like you need a master's degree to break into our industry. I don't even know that it would not make a difference. Yeah.
Thank you for saying that. I'm also super pumped that you said an associate's degree might be enough. I started with my associate's degree, and I
Yeah.
think that was my hardest degree. That
Yeah.
kicked my buns, and I'm a huge advocate for associate's degree. I think that they make nursing a lot more attainable for a lot of people. I know that it made it a lot easier for me to get my foot in the door and work my way up to a bachelor's and a master's. So I'm always the first person to really champion associate's degrees and really not to, I guess, minimize the accomplishment of that. So I love that you said that associate's degrees can also apply for these positions with the
Oh,
right certificate.
I'm the same way. I started at a junior college, community college, and got my associate's degree. Yeah, I was 18, started. I had my son also. He at 18, and I said, I've got to do that. I've got to figure this out. And then I always tell people if you find it, everyone has different financial situations. So I always say CVS was at one point owned Coventry Workers Comp. Where I had worked previously, and they do tuition reimbursement. So if you want to get your bachelor's degree and you feel like, there's no way I can afford this, that's a great place to start. CVS, Aetna, they have tons of positions open. If you hear the CVS and Aetna, you're going to free of charge. Okay. So, but they will pay for your degree. I mean, you have to obviously stay to work there for a little while, but you can work places like that, let them pay for your degree, and they're great places to work. They have great, benefits, things like that. So yeah,
It's a great
that
plan.
was a saving. That's how I obtained my degrees. Yeah.
Yeah, I'm not sure I could have done it without the associate's degree. I think knowing that it was only two really hard years made it so much more achievable for me, especially when I was younger too. And yeah, I paid out of pocket, went to a community college, and then my first nursing job paid for my bachelor's and my master's degree. So yeah, I'm a huge champion of the associate's degree. Very, very hard degree to get to.
Yeah. Yeah.
Um, so what's your best overall advice for nurses listening out there that want to do something similar in case management, whether it be workman's comp or general case management?
I would say you can do it. I mean, you can do it tomorrow. There is something out there for you to do. I mean, there's the possibilities are endless. And don't think because you just have an associate's or you've only been doing this for a short amount of time, there's something out there for you to get your foot in the door. And if at the end of the day, workers' comp's not for everyone. If you love hospice, if you love to really care on people, I don't think workers' comp might not be for you. But if it is, go ahead and get started. Go ahead and apply. Um, you may need to start, and like I said, in some other fashion somewhere else, but reach out to people like myself. I have tons of resources, tons of mentors that would love to help and love to guide you along. And work ethic, teamwork. I can't suggest that enough. Yes.
Yeah, work ethic will take you a long way. My dad is definitely my work ethic hero. He is wild with manual labor. We are building a house on a piece of land by ourselves, and me and my husband are out there on a tractor, like doing it manual labor, like shoveling rocks, doing it all. My parents are next to me doing it their way too. And it'll get dark and we've been up all day doing this manual labor, and me and my husband will just call it. My dad will just turn on the lights and keep going, which is wild. And I definitely take after him in that way. It's so inspirational to watch someone just keep going and working. So I definitely agree that some people have work ethic and then other people just don't quite have it.
You can't be taught. It's something you just cannot teach. And I'm from a small town. We are very much about hard work ethic, and I've been working since I was, I don't know, 15, and had to really work hard having my son so young. So I believe hard work is key. And so yeah, if you're willing to put in the hard work, this is definitely a career that, and again, it pays off. There's so many opportunities. Yeah.
hmm Well, Chelsea, thank you so much for sharing all this. I thought I kind of knew what case management was, and it turns out I had no idea. So, thank you so much for telling me more about it. I know that my listeners also appreciate you dropping so many amazing nuggets of wisdom throughout this conversation. So, truly, thank you for taking the time to speak to me today.
All right, thanks so much.
All right, this has been your Nursing Minute.